हेलो फ्रेंड्स, वेलकम टू दिस चैनल नर्सिंग नॉलेज। आज हम CCRAS 2019 का पार्ट 2 सॉल्व करने जा रहे हैं। द मोस्ट अप्रोप्रिएट मेथड ऑफ इंस्ट्रक्शन a nurse can use while teaching a post-operative patient deep breathing and coughing exercises. Option A, video presentation. Option B, explanation. Option C, pamphlet with pictures. Option D, demonstration. Correct answer is option D, demonstration. Next, the stage of interview that establishes the relationship between the nurse and the patient is the option A, examining stage, option B, surrogate stage, option C, working stage, option D, opening stage. Correct answer is option D, opening stage. Next is the nursing action to be promoted for the child with a high level of increased intracranial pressure is option A, scheduled range of motion exercises vigorously, option B, elevate head of bed to 40 degree and turn frequently from side to side, option C, elevate head of bed to 20 degree and position child so as to maintain head in midline, option D, suctioning every hourly as well as on demand. The correct answer is option C, elevate head of bed to 20 degrees and position child so as to maintain head in midline. Next question. A patient has clinically features of dyspnea, dependent edema, crackles, hepatomegaly, and jugular vein distension. The possible clinical condition that the nurse should suspect is option A, heart failure, option B, tension pneumothorax, option C, pulmonary embolism, option D, cardiac tamponade. The correct answer is option A, heart failure. Next, which electrolyte level should be checked by the nurse before administration of lithium to a patient with manic episodes? Option A, sodium, option B, chloride, option C, calcium, option D, potassium. Correct answer is option A, sodium. Next, barbecuing, a cooking method, is a form of option A, grilling, option B, sorting, option C, roasting, option D, baking. Correct answer is option A, grilling. Next, a clinical sign that indicates the beginning of second stage of labor is option A, gush of dark blood, option B, passage of mucus plug, option C, change in uterine shape, option D, bearing down reflex. Correct answer is option D, bearing down reflex. Next is a system of ventilation that blows fresh air into the room by centrifugal fan to create a positive pressure and displace the vitiated air is option A, AC ventilation, option B, plenum ventilation, option C, balanced ventilation, option D, exhaust ventilation. Correct answer is option B, plenum ventilation. Next, which technique is most suitable to move an unconscious patient? Option A, human crutch, option B, four-handed seat carry, option C, improvised stretcher, option D, hook grip. The correct answer is option C, improvised stretcher. Next is all of these are characteristics of groundwater except option A, cheapest source of water to small communities, option B, high in mineral content, option C, more prone for contamination than surface water, option D, requires no water treatment. Correct answer is option C, more prone for contamination than surface water. Next is a young lady spends several hours in organizing, reorganizing, and checking the order line, orderliness of a clothing cabinet. Her behavior indicates option A, obsession, option B, transference, option C, exhibitionism, option D, compulsion. Correct answer is option C, compulsion. Next, a leadership theory that propagates the leader to be a guide for the employees to help them acquire pride in the work and to inspire them to be actively engaged to achieve the mission and goal of the organization is option A, interactional, option B, transformational, option C, trait, option D, transitional. Correct answer is option B, transformational. Next, in an ECG, the wave of T wave is option A, ventricular depolarization, option B, ventricular repolarization, option C, arterial repolarization, option D, arterial depolarization. Correct answer is option B, ventricular repolarization. Next, a chemically defined determinants that change into complete antigen on combining with a carrier molecule is option A, complement, option B, phagocytes, option C, hep- heptanes, option D, epitopes. Correct answer is option C, heptanes. Next is which action confirms that the nurse is using Z technique to administer iron injection? Option A uses the anterior lateral aspects of the thigh to inject. Option B pulls skin downward or laterally before inserting the needle. Option C uses special syringe to administer injection. Option D creates a Z shaped grid on the abdomen and inject each dose daily. The correct answer is pull skin downward or laterally before inserting the needle. Next is the temporary hardness of water is due to presence of option A calcium bicarbonate, option B magnesium sulfate, option C calcium sulfate, option D calcium chloride. Correct answer is option A calcium bicarbonate. Next, the type of conflict a person experiences when he has two job options, one far away with good salary package and one near without scope for growth is option A approach, option B double approach avoidance, option C double approach, option D approach and avoidance. Correct answer is option B double approach avoidance. Next, the pasteurization method of heating milk to 63 degree for 30 minutes followed by sudden cooling is option A ultra heat treatment, option B holding, option C high temperature short time, option D radiation. Correct answer is option B holding. Next is while preparing a pregnant woman for amniocentesis, the nurse should option A instruct her to void, option B instruct her to drink 1 liter of water, option C prepare her for IV anesthesia, option D place her in left lateral position. Correct answer is option A instruct her to void. Next, the mineral that regulates muscle contraction and nerve transmission is option A magnesium, option B cobalt, option C sulfur, option D zinc. Correct answer is option A magnesium. Next is a cultural barrier for communication is option A social class differences, option B hearing difficulty, option C emotional disturbances, option D congestion. Correct answer is option A social class differences. Next is the statistical measure ANOVA is used to test whether or not the option A mean of two or more population are equal, option B mean of more than two samples are equal, option C means of two samples are equal, option D group differences in proportional exit. Correct answer is means of more than two samples are equal. Next is a dying patient is reserved and depressed. The appropriate nursing action is option A assuring that the patient can achieve goal, option B giving advice when appropriate, option C accepting the patient's behavior adaptation, option D asking patient to focus on positive thoughts. Correct answer is option A accepting the patient's behavioral adaptation. Next is the natural of the stated hypothesis. Women whose partner attended labor and delivery would need less pain relieving medication than women who were alone is option A simple, option B complex, option C non directional, option D null. Correct answer is option A simple. Next is arriving at a general conclusion based on specific observation is option A inductive reasoning, option B convergent thinking, option C deductive reasoning, option D critical thinking. Correct answer is option A inductive reasoning. Next is a mother in preterm labor receives injection betamethasone 12 mg. The action of this drug is to pro- action option A promote fetal lung maturity, option B prevent infection, option C improve fetal well-being, option D slow contraction. Correct answer is option A promote fetal lung maturity. Next is status achieved by the individual by the virtue of birth is option A achieved, option B attributed, option C ascribed, option D accomplished. Correct answer is option C ascribed. Next is an example for superficial reflux. Option A stretch reflux, option B Babinski reflex, option C biceps jerk, option D triceps jerk. Correct answer is option B Babinski reflex. Next is all of these are the muscles of mastication except option A sternocleidomastoid, option B temporalis, option C masseter, option D pterygoid. Correct answer is option A sternocleidomastoid. Next is which of these is a secondary stressor? Option A pain, option B death of spouse, option C ingested microorganism, option D cold weather. Correct answer is option A pain. Next is the permissible level of radiation per year to occupational exposure should not exceed option A 10 rad, option B 7 rad, option C 5 rad, option D 2 rad. Correct answer is option C 5 rad. Next is a 45 years old man of height 1.6 meter, weight 70 kg, calculate BMI is 27.3. He is classified as option A obese class 2, option B normal weight, option C pre-obese, option D obese class 1. Correct answer is option C pre-obese. Next is the most appropriate nursing action for the newborn suspected to have tracheoesophageal fistula is option A prepare for insertion of gastrostomy tube, option B encourage breastfeeding on demand, option C institute positive pressure ventilation, option D place the baby in prone position with head elevated at 30°. Correct answer is option D. Place the baby in prone position with head elevated at 30°. Next is an unresponsive child is lying on the floor. You shout for help. A check shows that the child is not breathing. The immediate action will be option A. Give external chest compression. Option B. Give chest thrust and back blows. Option C. Look for external defibrillator. Option D. Start artificial respiration. Correct answer is option A. Give external chest compression. Next is heart change appears in which stage of syphilis? Option A primary, option B tertiary, option C latent, option D secondary. Correct answer is option A primary. Thank you for watching this video.